This is Dr. Corey Maas on Looking Your Best. I had a filler patient today that came in for a second opinion after having her lips injected for the first time. The patient had over 2 ml of one of the products, the HA products. The primary two that are used in this country are Restylane and Juvederm, although Belotero is making a good inroad from the Maas company as an HA filler. All these fillers are the primary fillers used for the lips. The HAs are long-chain sugars that are cross-linked. There are subtle differences in their performance. We've talked about this before. The main ones being that Juvederm holds a little more body water, so it gives a little bit more of a puffy look. Restylane holds less, is a little stiffer and holds its structure. And there's Restylane Silk, and of course now Volbella, some newer ones we've talked about that can be used for fine lines respectively. But in general, when someone's coming for a first-time consultation for lips, that is a good question, is how much do you need? And there's not a right answer for that. I would say that the national average for lips is about 1 ml. And so if someone for a first-time injection, even if they want really big lips and they're starting with small lips, doing 2 ml is a fairly extreme amount of filler to do. And of course that beyond the swelling is not going to go down dramatically. So in general, there's a formula that we use for patients. For people who have small to moderate sized lips, I typically don't go beyond 0.5 to 1 ml tops. For people who have larger lips who have had experience with it, I will sometimes exceed 1, maybe 1.5 ml if we're just talking about enhancing the vermilion part of the lip. Now, I'm not talking about commissures or the fine lines or creases around the mouth, because that's a different indication, a different discussion. So if you're wondering about how much you need, and that's a question that's often asked because it's directly correlated to the condition you're starting with, I would just tell you starting with a half to 1 ml of any one of the products I described, and they all, as I said, have different characteristics that may be an advantage for you or a disadvantage, then I would tell you to stay in that range. The main goals we want are getting back to the beautiful lip. The beautiful lip is a diamond in shape. It's turned sideways, with the vermilion being the high point on each side. So a diamond in shape is what we're looking at. We don't want it to be the rectangle that it becomes when we age. And so the white lip gets longer. We want to keep that nice fullness. Definition of the vermilion border is very important, where we often see the smoker's lines with age. Having lip volume, particularly in the body of the lip. Very good study looking at lip attractiveness showed that a lot of volume in the middle of the lip is unattractive. We call that the tubercle. So it's the lateral, the body of the lip, and the upper. And the central lower lip, I saw a patient last week that had a lot of augmentation of the lower lip out by the commissure or corner, and that looks unnatural and attractive. Most of the volume should be in the middle portion of the lip. We do a technique we call the pillow technique, which really supplements or augments the natural cleft that's in the center of the lip. That's actually an embryologic feature, something we were born with. So if you have any questions about lip augmentation or enhancement, volume or technique or specifications, are you a candidate? And there's a lot of great questions I've had. Please don't hesitate to send me a photo, a video, or a question. You can do that as shared privately or publicly. Send that to drmaas.com. And as always, I'm happy to keep you looking your best.